Is your baby spitting up a lot? Are you concerned that maybe it's part of a larger problem? On today's episode, we're going to talk about normal spit up and red flags for a more concerning problem.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
For those of you who are new to the show, welcome back to Be Kind Pediatrics. My name is Dr. Blair Rolnick. I'm a pediatrician and mom myself, and we are going to talk all about normal spit up in newborns today. This is a question I get a lot from newborn parents because it is such a common thing that most babies do. So typically babies will start to spit up around 1 to 3 weeks old. And so why is that? All of us have between our esophagus, our feeding tubes, and our stomach, a muscle called the lower esophageal sphincter. And that muscle is like a little ring. You can see a nice picture of that here. And that ring closes to prevent food from coming from our stomach back up into our esophagus. But in newborns, that muscle is not quite strong and well developed yet. And so when they have any pressure on their tummy or their belly overly expands, that food can come right up their esophagus very easily. And it is more likely more belly expansion. So we'll talk about overfeeding in a second. But how do you know that this is normal spit up and nothing to be concerned about? The first thing is your baby in pain? So if they're spitting up and they're totally not bothered by it, they just kind of spit up and you all of a sudden look at your shirt or your burp cloth and you're like, wow, there's a bunch of chunky spit up on there. That's a pretty good sign that that is very normal spit up. 2, if your baby is growing well, so if they're gaining weight, they're growing in their length and their head circumference, that is a sign that there is nothing more ominous going on. 3, if they are eating normally, so they're not having any refusal to eat of the bottle, and they are not having any respiratory symptoms. So if your baby kind of seems like this typical happy spitter, they're just going on their merry way, they spit up a little bit and they keep going with their feed, that's really nothing to be concerned of. The other thing that's really helpful to talk to parents about is that typically happy spitters or GRE esophageal reflux, not GRED esophageal reflux disease. So typical happy spitter course is that they will start spitting up around 1 to 3 weeks old. And I always tell parents it will get worse before it gets better. So it tends to peak around 4 to 5 months old, and then tends to improve by 9 to 12 months. So about 90% of kids will have resolution of their reflux by 12 months of age. So what are some signs or symptoms that this is a larger problem and not just a happy spitter? The number one question I ask parents is, does it seem like they're in pain? If every time they spit up, they are screaming and crying, that is something that I would bring to your pediatrician's attention. If they're refusing to eat, so they are pushing the bottle away or spitting it out or crying and arching their back during feeds. If there is blood in either their spit up or their stool. If they ever spit up anything that is a dark green color, similar to my shirt, or green in general, I would always send a picture of that to your peds doc and make sure that it is okay. If the spit up is forceful, so this is one that's a little bit hard to define for parents. But forceful vomiting versus spit up, usually spit up is very passive. It just kind of comes out, versus vomiting really requires contraction of your abdominal core for you to get that up and out of your esophagus. So if it looks like they're really using their abdomen to spit it up, that is also, I would always say, like, take a video of it. We have this amazing power of all of our cameras being with us all the time. You know, a picture or a video is worth 1,000 words. If you think that it's forceful or you're not sure, take a video of it and send it over to your pediatrician. If their belly is swollen, if it's distended or it's hard, that is a more emergent reason to call your pediatrician, as well as blood or dark green vomit. If your baby is wheezing, coughing, fast breathing, or having any respiratory changes with feeds, I would bring that to your pediatrician's attention. If they turn blue or apneic, blue around the mouth or apneic, they stop breathing, I would call 911. And then, of course, let your pediatrician know afterwards. And then lastly, if you're having concerns about their weight gain or growth, this is something that really your pediatrician will be tracking on every well visit. So if you're concerned about their spit up or they are spitting blood, just bring it up, let your pediatrician know so that they can take a look at their growth curves and make sure that everything is copacetic. If your pediatrician suspects that your baby has GRED, so GERD, esophageal reflux disease, as opposed to esophageal reflux, GRE. They may recommend that you see, or they will likely recommend that you see a pediatric GI specialist for pharmacotherapy, or they may recommend for formula-fed babies a trial of a fully hydrolyzed or elemental formula for a few weeks, 1 to 2 weeks, to see if it makes a difference. We used to, in the past, recommend things like PPIs and H2 blockers more frequently than we now do. In the past decade or so, NAFSAGAN, which is kind of the governing body of pediatric gastroenterology, updated their guidelines in 2018 and really strongly recommended that we don't consistently use PPIs or H2 antagonists for newborns unless we were really concerned that they have GERD, GRED, because there were so many side effects of the PPIs and H2 agonists, like risk for pneumonia, etc. So it's not usually our first tool that we reach for anymore. So what are things that you now can do at home for your newborn to reduce the amount of reflux? So the first thing you can do is, again, let your pediatrician know. Make sure that they're growing appropriately. You want to ask your peds doc if you're bottle feeding your baby about how many ounces, just run by them, like how many ounces you're feeding your baby and how often. Again, overfeeding your baby will stretch their stomach and allow that contents to be regurgitated up more readily. So they might recommend smaller, more frequent feeds. They may recommend a 2-week trial of a hydrolyzed formula. There wasn't great evidence for this. This was a weak recommendation, but they still, NAFSAGAN, that society still recommends that you give it a try before any pharmacotherapy. Same for moms. They may recommend a 2-week trial of dairy elimination from your diet. You can and should keep your baby upright for 30 minutes after feeds. You want to avoid any really tight-fitting diapers or waistbands. So this is one that often gets overlooked, but if you've got your baby in some really cute little pajama pants that are super tight around the belly, that can also cause them to spit up more. So just loose-fitting diapers and waistbands. And lastly, you want to avoid that car seat positioning while at home because it puts pressure on the tummy. So avoid those tight-fitting waistbands, diapers, and car seat position. Do keep your baby upright for 30 minutes after feeds. Do run by how much and how often you're feeding your baby by your pediatrician. And do check and make sure that they're growing and gaining appropriate amounts of weight. So just like we always cover the do's, let's also cover the don'ts. So the do not here is really do not elevate your baby's bed when they're sleeping. There is no evidence that suggests elevating the head of your baby's bed, crib or bassinet, reduces spit up, and it's actually dangerous. So you want to leave your baby the safe sleep precautions on a flat, hard surface, nothing else in the crib or bassinet. And then I'm going to close out with a little bit of a reflux myth buster. So there was, for a long period of time, people thought that frequent burping might actually improve spit up. There is this idea that babies might be swallowing too much air and that might be contributing to the amount of spit up they were having. But there, since then, has actually been some randomized controlled trials that showed that actually in healthy babies, burping more frequently actually led to increased spit up. So this is one that area that I really like to highlight for patients as an area of education, that over burping or focusing excessively on burping your baby is not going to improve their spit up, and it actually might make it worse, especially because this is often something they're hearing from older generations, stop and burp your baby more frequently. This was something we used to recommend in the past, but we now know is not true, and actually not only is time consuming and puts a lot of pressure on parents to burp babies, but actually might make it worse. So again, if you're dealing with a spit up baby and you're wondering, could it be normal or should you be concerned about something more? I hope that you find this episode helpful. If you ever have any concerns about your baby's health, you should, of course, always reach out to your pediatrician. I hope you found this episode helpful. And if you have any comments or questions, please leave below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.